Let's discuss dysmenorrhea. What is dysmenorrhea? Dysmenorrhea is menstrual cramp or painful period. There are two types of menstrual cramps: primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea happens to young girls who just started seeing their period, especially in the first 5 years of their menarche. That is the first 5 years when they start seeing their period. So it's when the uterus, the womb is shedding off. It causes spasm or cramp, and they complain about lower pelvic pain, lower abdominal pain, back pain. So at this time, these are the things you need to do. Go and get heating pad. Or if you don't have access to heating pad, you can get a warm cloth or warm towel. Make sure that the temperature is not too hot to burn the skin. Place it on their lower abdomen. That will help cool and bring comfort. Another thing that you can do is also to get like pain medicine called NSAIDs, like ibuprofen, Aleve, Motrin. Give it to them. They can start 1 to 2 days before their period starts. So if they know their cycle is regular, they already know that their period is going to start in maybe next 2 days. They can start today to take the medicine and continue taking the medicine even during the period to help reduce that cramp. Another thing you can try is vitamin E. Is over the counter, or vitamin B6 is over the counter. Take it before and during the period. So take it 1 to 2 days before your period starts and continue until your period ends. That will also bring relief to those menstrual cramps. Another thing is birth control. Birth control has been found to help relieve menstrual cramps. Menstrual cramp can continue years after menarche, but can stop after they have their children. So do these things, help your daughters to feel comfortable during this period. Another thing I'm going to talk is secondary dysmenorrhea, which happens to women who maybe they have already born their children, or maybe they not really older, but like when they started seeing their period, there was no menstrual cramp. But all of a sudden later, they started having menstrual cramp, which is not usual to them. This is called secondary dysmenorrhea. And this place needs to be addressed with your medical provider, because a lot of things could be the cause